Good afternoon, everybody. I am really pleased and honored to be joining this discussion, and in particular to be representing the work of so many New York City Department of Health employees, both current and former, who've been part of our efforts to tackle sugary drinks, which really have been ongoing for over a decade now. So this is an overview of what I'm going to missing the overview, but I'm going to give a quick overview of the work, the local landscape that we have, and then move on to the challenge of sugary drinks and the various strategies that we've done to try and address them. And then we'll turn to some reflections, including the importance of localities in this work. I'm happy to be here representing efforts of localities today. So turning to local level data, I want to first begin by really providing some of the background and context of what our neighborhoods look like in New York City, and particularly draw attention to the fact that we have disparities by race in New York City, even though our local health department does put a priority on health equity in our work. If you see the darker regions of each map above, you can notice that the neighborhoods with the higher premature mortality rates track closely with the neighborhoods that have higher concentrations of lower income and non-white households. Really, these differences in health outcomes, and what we're talking about is reduced lifespan, are avoidable, unjust, and unfair. And of course, this doesn't mean that everyone else in New York City is healthy, and it is our role as a health department to promote the health of all New Yorkers, but it does mean that we have to pay special attention to this issue and focus our efforts. Digging a little bit deeper into this, we know that if we look at patterns of sugary drink consumption, we also see that all neighborhoods are not the same. So these maps are showing that in the darker red areas, we have neighborhoods that have higher rates of the population reporting drinking one or more sugary drink per day. The darkest red areas on the map, we have rates of 35 to 42% of adults reporting drinking one or more sugary drink per day. And then similarly with diabetes, the highest rates in the areas that are the darkest on the map. So taken together, all of this makes plain that we can't really look at any one risk factor in isolation. We have to consider the larger societal context and structural factors that contribute to the disparities we're striving to address. So I want to turn now to the importance of sugary drinks, and there's been a lot of discussion this morning about the health impacts and why we should be so focused on this area. And we really, because these are empty calories and they make such a significant contribution of the amount of added sugars we're consuming, we see them really as a singular public health opportunity. And while the health risks of sugary drinks have been amply discussed this morning, I do want to note that in New York City, we see concerning disparities in the related health risks, the health outcomes, with rates of obesity and diabetes among Black and Latino New York City adults being twice or nearly twice the rates that we have among white adults. So I also want to take a minute to just talk about what we're really up against when we talk about taking on and tackling sugary drinks and trying to reduce consumption. Because we know that in New York City, when we are thinking about New Yorkers trying to make healthy choices, they're really navigating a complicated and somewhat treacherous environment. Sugary drinks are highly available, they're saturated in our retail settings, they're served in large portion sizes, and they're relatively inexpensive. They're also heavily marketed to youth, low-income neighborhoods, and communities of color, as has already been talked about a bit this morning. But we have been doing some local-level scans as well, and we've seen that saturation of sugary drink promotion in some of our most low-income communities. So, for example, a 2012 health department study found that 86% of food and non-alcoholic beverage ads in supermarkets and bodegas, those are our corner stores that we affectionately call bodegas, in the South Bronx neighborhoods were for sugary drinks. So even if we can say that this marketing isn't directly targeting the population that we're focused on today, the 0 to 5s, we've talked about the role that the family really plays. So if it's reaching the adults and the big brothers and the big sisters and they're bringing the products into the home, we know that this is also impacting the behaviors of the 0 to 5s. So all of this really sets the context of the challenges that we have as a local health department, and in particular, the amount that we're really dwarfed by the funding that the industry has to get out its messages and its strategies. All of these factors together paint a really troubling picture. We have disparities in sugary drink consumption between groups, similar disparities in related health outcomes, and then we have communities that are overloaded with sugary drink advertising. And I just shared this because we know that the question is often raised, what's really the role of government? Why is government getting involved in beverage choice? But we have to remember that government is not inserting itself into a neutral landscape. This is a landscape that is shaped by a whole host of structural factors and industry actions, and it really is our role to step in and try and level the playing field. So how do we do that? This slide talks about a familiar mantra in public health, but it really is our kind of guiding light. We make an effort to make the healthier choice the easier choice. And what's reflected here is depicting the role, it's depicting the interaction between how individual and environmental factors affect people's ability to make healthy choices. So we do our work with the awareness that even individuals with skills and the knowledge and the desire to make healthy choices will struggle to do so when the environment is working against them. And that means that we focus a lot of effort on resourcing individuals, but also in really trying to flatten this slope. Speaking to our food and nutrition work more generally, we take a multi-pronged and holistic approach, and we really do try and do both of these things, which is to increase access to and awareness of healthy foods, but also to decrease the availability and overconsumption of unhealthy foods. In the first area, we have a whole host of efforts that go from nutrition education to working in retail settings to incentive programs at our local farmers markets, and then in decreasing, it's been everything from reducing sodium in the food supply to our trans fat work, and then the efforts on sugary drinks that I'll focus on now. So with regard to this, we've really looked at the levers that are available to us, the spaces we control, our programs, our abilities to educate, and we've also sought to influence broader policy areas. One of the efforts that's most relevant for today is our policies and programs to work with and foster support of healthy behaviors in children. In New York City, we do have a Board of Health that regulates our child care centers, and through that it reaches approximately 140,000 child care seats at around 2,300 group daycare sites. So with the support of the Health Department, we made a recommendation to the Board of Health in 2006 to amend our health code to include physical activity and nutrition requirements, including prohibiting the service of sugary drinks, requiring appropriate juice portion sizes, and increasing the availability of drinking water. In 2015, we updated these standards and at that time reduced the portion size of juice limit to 4 ounces a day from 6 and required that juice only be served to children over 2 years old. We also complemented this effort by extending the health code to address day camps, and we required that children in day camps have access to water and prohibited the service of sugary drinks there as well, along with higher fat and flavored milk. We also put a focus on nutrition education in child care settings, complementing our policy efforts through the Eat Well, Play Hard program that Heidi referenced, that we get SNAP Ed dollars through the state to do that, and it's a 6-week nutrition education program that reaches many of our children and child care providers each year. So going beyond childcare, we've also looked to limit sugary drinks in other settings. One of our major efforts was the adoption in 2008 through a mayoral executive order of food standards that set nutrition criteria for meals and snacks purchased and served by city agencies and offered through our city programs. They reach approximately 250 meals and snacks per year. The standards allow only beverages that meet a calorie threshold of 25 calories per 8 ounces to be purchased with city funding. 100% juice is permitted, but only in limited portion size. Water is also required to be available at all meals. In 2009, we set standards for beverage vending machines in city spaces, and those standards limit access to sugary drinks to 2 slots in a vending machine and limit the portion size to 12 ounces. For machines and programs that serve children, the standards are stricter, and they allow for no sugary drinks. The standards impact many environments that children are in, including after-school programs and parks, as well as child care settings, to name a few. We've also expanded the reach of these standards through mentoring and technical assistance to hospitals, as well as an adapted version of the standards, that's the New York City Food and Beverage Guidelines, through which we work with CBOs and faith-based organizations to also adopt their own organizational policies that limit access to sugary drinks. We have a whole host of other initiatives to promote sugary drink or healthy beverage policies, but I'm not going to go into because of time. But I do want to just mention that water promotion is one of our key strategies and one of our core messages in those efforts. So some of the other broader policy attempts that we've made, the things that are reflected here are things that the city has tried to do, but none of these have actually been implemented. In 2010 and 2009, the state had considered a sugary drink tax, and this health department played a supporting role at that time. This ultimately withered in the legislature, but did draw media attention. In 2010, as has been discussed, New York City did make a request to USDA to conduct a 2-year pilot project that would have eliminated sugary drinks from the allowable purchases with SNAP benefits. We sought to conduct an evaluation. USDA ultimately denied the request in 2011. And then in 2012, we attempted to introduce a portion cap. And the aim of this proposal was really to reset the defaults around portion size. It was based on health evidence that portion sizes influence consumption. This generated a good deal of controversy, but it meant that we also got tremendous media attention and continued the conversation about sugary drinks. So in addition to some of the earned media that we've gotten through various policy proposals, New York City's also made an effort to educate New Yorkers through mass media campaigns as well as nutrition education programs. So I mentioned earlier our nutrition education work in childcare centers. We also have nutrition education for the general public at farmers markets in low-income neighborhoods. And there is a module on sugary drinks in that as well. But of course, we can't reach all New Yorkers through this kind of hands-on nutrition education. So we've had mass media marketing campaigns since 2009. And you can see they take a variety of forms from quite graphic, the Pouring on the Pounds campaign, to the more logic-minded MAPS campaign, which showed how far you'd have to walk from well-known New York City landmarks in order to burn off sugary drinks. We also have had specific campaigns that have been oriented towards youth. You can see here the tagline, "Your kids could be drinking themselves sick," and it's featuring actually a fruit drink to draw that distinction between 100% juice and fruit drinks, as well as a focus on water promotion. So where does that leave us? Where have these efforts gotten us? This is showing trend data that we have in New York City, and it shows a 34% decline in consumption, and it highlights the various different initiatives that were implemented or attempted during this time. While this is observational and we cannot attribute these numbers to any specific policy or effort, we have been encouraged to see the numbers moving in the right direction. The slide also shows across the bottom some of our ongoing work that undergirds our sugary drink efforts. We really often focus on these larger policy announcements or initiatives, but you can see we've had a sustained commitment to surveillance as well as nutrition education and media campaigns throughout these years. While we have been happy to see the numbers moving in the right direction, this slide reflects the disparities that you can see. So we've had a significant downward linear trend from 2007 to 2015 for all racial and ethnic groups as well as overall. But these gaps are persistent and we haven't made much progress in closing them. Similarly, if we look at youth-specific information, the slide shows the overall prevalence of children from ages 6 to 12 in consuming 1 or more sugary drinks per day. The overall prevalence in 2009 was 44%, but again, you see these concerning disparities. We actually have a more recent analysis of sugary drink consumption in youth coming out, and it will include data on 0 to 5, and we're hoping to release that shortly. So what are the takeaways? Really, we know that there's no silver bullet in improving diets generally, and this has certainly been true for sugary drinks as well. So cross-cutting efforts are absolutely needed. Many approaches taken together are required. We know that localities have played a critical role in trying different things and attempting to innovate. We also benefit very much from learning from each other. We're informed by the shifts taking place in other jurisdictions, from research efforts, and from the standard setting and research that happens at the federal level. It's also very crucial to acknowledge the importance of continued federal funding for local prevention work. It's been a significant part of our efforts in New York City. I think it's also worth emphasizing the importance of trying things. This is needed because, as has been discussed very much this morning, the status quo is really unacceptable. And so in New York City, we, and many of my predecessors, have made attempts where there really wasn't a clear path to follow. And while not everything has been implemented, we have seen that those efforts played a significant role in raising awareness of the health risks of sugary drinks and really contributing to an important national conversation, and often a very noisy conversation. And those efforts have made a difference. So after the effort to introduce the portion cap in 2012 made international headlines, we saw the largest single-year drop in sugary drink consumption between 2012 and 2013. Finally, I do want to emphasize how crucial it is for us to keep health equity at the forefront of our work. Surveillance has been critical for us. It's been critical in terms of assessing progress, but it also in highlighting the remaining disparities that we do have. What we've seen in New York City has been positive progress, but our data, and particularly the stark disparities in both sugary drink consumption and related health outcome, tell us that we have a lot of urgent work left to do. So onward. Thank you.